Hello, I'm Dr. Arun Lakhanpal. Today I'm going to speak to you about tuberculosis or TB. The reason is the extensive incidence rates and prevalence of tuberculosis in India. And despite a very robust national control program and the expertise that we are fortunate enough to have, the incidence of tuberculosis as well as the incidence of drug-resistant tuberculosis is on the rise in our country. Worldwide, there are about 9.6 million patients estimated to be suffering from tuberculosis, with an annual incidence of 2.2 million in India. And it is estimated that 40% of us have already had primary tuberculosis at some point, which even without treatment is perhaps kept under check by our immunity and is called latent TB, which has the tendency to flare up at any point when our immunity goes down, either due to medication or diseases such as diabetes. Tuberculosis can affect any organ system of the body, starting from the brain, to the bone, to the genitourinary system, to the liver. Can be a disseminated infection, which is lymph nodes all over the body, but by far the organ most commonly involved is the lung. So, if you have had a prolonged fever, or if you have had a cough, whether or not with sputum production which has persisted for more than 3 weeks, or if you are losing weight without dieting or exercise, that is, if the weight loss is unexplained, you must consult your doctor. Or infertility, if the TB has affected reproductive organs or the genitourinary system. If you have any of these symptoms, you must consult your doctor, who might want to do a number of tests, the most definitive of which is a sputum examination and a chest x-ray, with actually seeing the TB bacteria in the sputum being the gold standard, as well as growing the TB bug in culture. The doctor might want to do a CT scan or an ultrasound or various other tests depending on what he suspects is the primary source of symptoms or the primary organ involved. Every effort should be made to have a sample, whether it be fluid in the chest or sputum or a needle aspiration from an abscess or from a lymph node. This should be sent for TB culture so that we can confirm the diagnosis by growing TB and testing the medications on the sample to exclude drug-resistant TB. Then your doctor, after confirming the diagnosis, will start you on treatment, which is a number of tablets, including drugs like rifampicin, isoniazid, ethambutol, and pyrazinamide, along with vitamin B6. Although if the patient is incredibly ill, based on the imaging and the symptoms, your doctor might want to start you on anti-TB treatment empirically, that is, based on suspicion only, to save the patient's life. You must also be aware of drug interactions that happen with tuberculosis. So the females who are on oral contraceptive pills might have to take, or actually must take, additional contraception, because rifampicin can lead to oral contraception failure. And also, if you're on tablets for fits, make sure the levels are checked regularly. It is important that you do not stop the treatment without consulting your doctor. It is also important to be aware of the side effects, and almost all of the patients who go on anti-TB treatment have some degree of adverse effects, most of which are nausea, indigestion, loss of appetite. These are perfectly acceptable and tend to settle down with time. The medication called rifampicin must always be taken on an empty stomach, and if you are on other medications such as proton pump inhibitors, the timing of those medications can be moved to later on in the night, or if you are on oral thyroxine tablets, you might want to give sufficient gap between rifampicin and the oral thyroxine replacement. All the TB drugs should be taken as close to each other as possible, but to improve tolerance, you can split the medications to be taken at different time of the day, but as close to each other as possible. Do ask your doctor on what alarm symptoms or significant symptoms to look out for when you should be contacting your doctor. But under no circumstances should you stop the medications without consulting your doctor. If there is persistent nausea and vomiting, or if you see jaundice, which is yellowing of the white area of your eye, or if your vision starts to get blurry, or if there is any problem in hearing, you must report the symptoms to your doctor immediately. You can expect the color of your urine, tears, and all the body fluids to change to orange, and that is because of the medicine per se. Additionally, you need to be aware of the precautions to take so that you do not pass on the infection to your family members and the others that you may work with. Let me reassure you, extrapulmonary tuberculosis, that is TB of organs other than the lung, is non-infectious. But genitourinary tuberculosis has a potential to be passed on by intercourse, and most commonly the tuberculosis of the lung is highly infectious, especially if your sputum has isolated tuberculosis on a slide examination, that is a smear. If that is the case, then you do need to take some precautions, such as wearing a mask, which may be a single surgical mask, but ideally should be an FFP1 grade or higher medical mask. You must try and confine yourself to one room of your home which is well ventilated and gets enough sunlight, because UV rays in sunlight are known to deactivate the tuberculosis bacteria. And these precautions are generally only needed for up to 2 weeks after having started the TB treatment, and are only to be taken if you are productive of sputum, that is you are coughing up phlegm. If you are coughing up infected phlegm, you need to dispose it off safely. In India, the recommended method is to collect the day's worth of sputum in a container, preferably earthen, such as a cooler, which has lime or sand in it, and it's left covered throughout the day. At the end, you can either bury it or burn it. The sample can also be safely disposed of with a hospital or a laboratory who have biomedical waste disposal facilities. After completion of the 2 weeks of treatment, if your phlegm has settled or if you are still productive, your doctor might want to check your phlegm to make sure that the TB bacteria have disappeared, at which point you may no longer need to be isolated from others. The duration of treatment for TB, as recommended by WHO, for TB other than TB of the brain and nerves and spine, is a minimum of 6 months, but can extend up to a year for brain and nerve TB and can go up to 1.5 years for spine or bone tuberculosis. This is the minimum recommendation. Your doctor, depending on the resistance pattern prevalent in the community or the extent of disease in your case, may want to extend the treatment or add injections or further tablets depending on your culture results. At no point should you stop the treatment without consulting your doctor. Leaving treatment halfway through may result in you having a recurrence of tuberculosis, which is drug resistant and extremely difficult to treat and can be potentially fatal. Apart from treatment, you must take care of your nutrition and take high protein diet. Keep your diabetes strictly under control and avoid smoking, and under no circumstances should you consume alcohol during the time and for up to 6 months after finishing the TB treatment. I hope this answers most of the questions that you might have about TB and its treatment, but this is by no means comprehensive, and if there are any further questions, do ask your doctor.